The course was developed with young people, CAMHS professionals and Barts Health staff to develop a competency framework and training for staff caring for young people who present in mental health crisis or mental health conditions. We've called this course WeCanTalk.
There's a lot of misunderstanding around why young people end up in A&E and mental health crisis, and the sad truth is a lot of the time they feel like they have nowhere else to go. The majority of young people are very experienced and very adept at dealing with their own mental health problems themselves and treating self-harm, and they've actually reported that they'd rather do this than go to A&E because a lot of them have had bad experiences in the past. So when young people do end up in A&E and mental health crisis, it's because something different has happened. It's either worse, something they can't deal with themselves, or they feel like they've been forced to go by someone else. What's really sad is that a lot of young people report that when they do turn up at A&E in mental health crisis, they do so with feelings of shame and unworthiness.
Barts Health initiated this programme because it wanted to support staff to feel more confident and knowledgeable in caring for these young people. So I approached Health Education England to support me, which they were very keen to do and are very keen to learn from it as well.
We are taking on not only the views of experts within child and adolescent mental health, but we're also asking the staff that we're training about what their training needs are. And then we're asking children and young people, what do you want staff to know about when it comes to their mental health needs? So we've developed it in a collaborative way rather than it just being one-sided.
It's been really useful for me, actually. I hold a senior position in my department, and I've never had any mental health training before today. And I can see how this is really going to be useful in my everyday role and in my role supporting my staff.
The training's been really engaging and clearly know a lot about what they're talking about. They've also made it really relevant to our fields that we work in the hospital.
I think the main thing is about teaching, about interacting with people just as humans, because we do tend to look at what they've got, like the mental health issue that we've identified, rather than thinking of them as actually children and patients. So that so far is one of the key things, I think. It's definitely relevant to all our work in A&E. It's covering kind of the issues that come up for us specifically, and I'm looking forward to learning more about how we approach them and how we deal with things.
They'll be looking at, in the morning, thinking about how they understand mental health problems, some of the mental health difficulties they encounter in their clinical practice. And then in the afternoon, really thinking about, well, how do they respond? How can they respond better? Thinking about how we communicate, because actually mental health is a really difficult subject to think about sometimes and can be awkward to talk about, and we don't always feel like we get it right. And so this afternoon will really be about putting that into practice and having a chance for it to feel awkward in a room where they hopefully feel quite supported and contained, so that we can really try and drive on their skills.
If one nurse feels more confident about asking a young person how they're feeling today, then this project will have been a success.
Since the staff have attended the course, they feel more able to explore the emotional needs of a child, whereby they might have focused on their physical health. Having attended the training, they are taking a much more holistic view.
Young people attending A&E and mental health crisis want the same as what any person attending A&E for any reason at all would want, and that's appropriate care, to be involved in decisions about their care, understanding, empathy, a non-judgmental approach. And like, young people understand that sometimes certain things have to happen to keep them well, and they can't be involved in the decisions about what happens, but young people really appreciate being involved in the decisions about how those things happen.
I'm definitely much more confident at speaking to young people about their physical and emotional needs and being able to point them in the right direction of what support is out there.
I was worried that I might ask the wrong question at the wrong time, but attending the course has helped me quite a lot.
I feel like I can talk to a young person now as a young person and not look at them as someone that's got a mental health problem and that's all they've got. You know exactly what questions to ask and how to ask them.